Can you believe that an 83-year-old man still consistently satisfies his wife twice a week without taking any medication? While many men in their 50s begin to complain about a decline in sexual function, there are still men over 80 who maintain peak performance, just like they did in their youth. So, what's the secret behind this miracle? It's not expensive supplements or costly hormone therapies, but simply a simple daily habit: massaging the penis properly. It may sound hard to believe, but science has proven that just one small action, when done consistently and correctly, can stimulate blood circulation, boost male hormones, and sustainably preserve natural erectile function. So, what's the truth behind it? How should it be done correctly? And why have thousands of people tried it and seen results? Let's explore it right now. Before we continue, please give me a follow and turn on notifications to discover useful knowledge that not everyone shares. If you find the content helpful, press 1. If you think something needs improvement, press 2 and let us know. Thank you. Now let's dive in and explore the natural physiology of erections so we can understand how to care for them properly. Hello, everyone. I'm Dr. Laura, and today I'd like to share with you a topic that might seem familiar but is often misunderstood: the physiological process behind male erections. When we understand this process, we can support the body in a natural and safe way, especially as we age. First, it's important to understand that an erection is not just a mechanical reaction. It's the result of a highly sophisticated coordination between the nervous, circulatory, and endocrine systems. When stimulated either psychologically or physically, the brain sends signals down the spinal cord, which then transmit to the nerves in the genital area. These signals trigger the body to release nitric oxide, NO, a compound that plays a key role in dilating blood vessels in the corpora cavernosa, a special tissue in the penis. This dilation allows more blood to flow in and get trapped, leading to an erection. What's interesting is that this entire process heavily depends on the health of blood vessels and testosterone levels. As men age, testosterone levels tend to gradually decrease, along with the weakening of blood vessel walls and nerve reflexes, which makes the process of achieving an erection less sensitive and less powerful compared to when they were younger. One important thing to note is that erections are not only related to sexual activity, but also reflect overall health, including cardiovascular and endocrine health. Men who suffer from high blood pressure, diabetes, high cholesterol, or prolonged stress often experience a decline in erectile function. Therefore, caring for male sexual health cannot be separated from maintaining overall health. One thing that gentlemen should keep in mind is that an erection is a natural reflex. There's no need to feel embarrassed or shy about changes in your body. On the contrary, if this ability decreases too quickly, it could be an early warning sign of underlying health issues, from low testosterone to blood circulation problems. From this physiological foundation, we can see that in order to maintain a healthy and natural erection, support is needed from the nervous system, blood vessels, and hormones. In addition to a balanced diet, exercise, and proper rest, simple exercises or massage therapies like massaging the penis can have positive effects. It helps improve blood circulation, maintain flexibility, and reflexes in the area, especially for those in middle age and beyond. In conclusion, if we know how to take care of our bodies properly and understand the changes that come with aging, it is entirely possible to maintain sexual health in a safe, natural way without relying on medications. There are 2 benefits to massaging the penis gently every day, which leads to long-lasting effects. Ladies and gentlemen, in the field of male health, there's a simple habit that brings many benefits, though many people don't fully understand it or often overlook it: massaging the penis every day. First, let me emphasize that this is not an act of arousal or a private, sensitive act. It is a form of physical health care, similar to massaging your hands or legs to improve blood circulation or exercising your joints in the morning. A gentle massage of the penis, when performed with the goal of care, not only helps improve sexual function but also supports blood circulation, maintains the health of the tissues, and reduces the risk of erectile dysfunction in middle age and beyond. Here are the specific benefits, supported by clinical experience and feedback from many patients. First, benefit is stimulating local blood circulation. When performing gentle strokes from the base to the tip of the penis, the mechanical pressure helps dilate blood vessels slightly, increasing blood flow to the corpora cavernosa, the tissue responsible for erections. This is similar to how exercise pumps blood to your limbs, helping maintain sensitivity and reflex in that area. Second, reducing the risk of fibrosis in the corpora cavernosa. One of the causes of reduced erectile function with age is the phenomenon of fibrosis in the corpora cavernosa, which occurs when the internal spongy tissue hardens and loses its elasticity. A proper massage, like a light physical therapy exercise, helps keep the corpora cavernosa soft, flexible, and elastic, thus maintaining better functionality. Third, supporting hormone balance. Many studies show that gentle stimulation of the genital area can activate the neuroendocrine axis, supporting the natural production of testosterone. Of course, this cannot completely replace a proper diet or sleep, but it plays a highly beneficial role in overall endocrine health. It also increases body awareness and improves control over sexual function. By maintaining this habit, men will learn to listen to and observe changes in their bodies, which is essential for recognizing early signs of issues like reduced libido, infections, or weak erections. Having a good connection with your body also helps men control their sexual reflexes better, prevent premature ejaculation, and improve the quality of their intimate relationships. Fourth, mental relaxation. Even just a few minutes a day can help create a sense of peace, confidence, and reduce stress. In men's health, psychological factors play a significant role, especially for older men. A stable mood supports the recovery of sexual function. In conclusion, massaging the penis every day, when done gently, correctly, and consistently, can be considered a simple, safe, and cost-effective home exercise. It is suitable for men of all ages, particularly middle-aged and older men. So you may wonder, how do I perform the correct massage technique safely and effectively? Ladies and gentlemen, when it comes to massaging the penis, the most important factor is not the strength of your grip, but the proper attitude toward body care and the gentle, scientific technique. This is not an act of arousal, but a form of physical therapy, similar to how people massage their shoulders, neck, or limbs to relax and improve blood circulation. To maximize the benefits, we need to perform the technique correctly, at the right time, and for the right purpose. Below is a detailed guide on how to safely and effectively massage the penis in full alignment with male health recommendations. The ideal time to perform the massage. The best time to perform the massage is early in the morning after waking up, or at night before going to bed. At these times, the body is relaxed and more receptive to gentle physical stimulation. Particularly in the early morning, testosterone levels are at their highest for the day, which helps blood circulation and improves the response in the corpora cavernosa. Preparation. First, ensure that the genital area, your hands, and nails are clean to avoid any risk of infection. You should use a small amount of coconut oil or a natural lubricant to reduce friction and increase smoothness, allowing for a gentle stroke that won't damage the skin. Create a quiet, private, and comfortable space to allow your body to relax and avoid stress. How to perform the massage. Use your thumb and index finger to form a light circle, similar to the shape of the letter O, and begin from the base of the penis, gently stroking along the length towards the tip. Each stroke should last around 2 to 3 seconds. Perform the motion consistently and rhythmically, without the need for full erection. Doing it in a relaxed state is enough. The goal is to stimulate blood circulation, not arousal. Aim for about 30 strokes each day, depending on your time and physical condition. It doesn't need to be long. Around 5 to 10 minutes per session is enough to achieve long-term results. Important precautions. Don't use too much force that causes pain or discomfort. The strokes should be light, consistent, and slow, just like how people care for their facial skin or massage the soles of their feet. Avoid performing the massage when you're angry, tired, or stressed, as these factors can negatively affect the balance of hormones and blood circulation. If you feel pain, discomfort, or notice any unusual symptoms such as bleeding or swelling, stop immediately and consult a specialist. 5. Maintaining consistency to see results. Just like with any other form of training, regular massaging is effective only when performed consistently. After 3 to 4 weeks, many people begin to notice significant improvements in sensitivity, erectile function, and feel more confident during intimacy with their partners. In short, massaging is not just a simple action, but a proactive, natural, and safe form of male health care. When done gently and correctly with the right mindset for self-care, it can be the silent yet sustainable secret to maintaining peak performance at any age. For combining with additional complementary methods for optimal, comprehensive results. Gentle massaging every day is a great step to improve blood circulation and support sexual function. However, to achieve lasting and comprehensive results, especially for middle-aged and older men, it's important to complement the practice with other supporting methods. This is not just about external care, but also about taking care of the body from the inside. First crucial element is maintaining a scientific lifestyle. No method will be effective if we stay up late, eat irregularly, and neglect exercise. Make a habit of maintaining a regular schedule, getting enough sleep, especially before 11 p.m., which helps the body produce testosterone more effectively. Engage in light daily exercise, such as walking, yoga, or pelvic exercises like Kegel. These exercises help improve control and maintain firmness. Eat a balanced diet, prioritizing leafy greens, fresh fruits, fish, and nuts, while avoiding excessive salt, deep-fried foods, and limiting alcohol, cigarettes, and other factors that deplete male hormones. Second, managing mental health and stress. Older men often carry worries about finances, family, and health, which can create mental strain. Chronic stress is one of the biggest contributors to erectile dysfunction and a reduced libido. It's important to learn how to relax through meditation, listening to soothing music, engaging in positive conversations, or simply spending time on personal hobbies. Third, regular health checkups. Many men are reluctant to visit urologists, but regular exams can help identify potential issues with the prostate, hormones, and cardiovascular health, all of which are linked to sexual health. Prevention is always better than treatment. In conclusion, combining regular massaging with a scientific lifestyle, mental stability, and regular health checkups is the formula that will help men maintain their performance and confidence over the years. Fourth, a real-life example from an 81-year-old man in the Midwest. A lesson in persistence and understanding your body. There's no more convincing proof than hearing a real-life story about the effectiveness of proper sexual health care. Today's story comes from Mr. John Thomas, an 81-year-old man from Ohio, who has surprised his family and doctors with his sharp mind, vitality, and stable sexual health even at such an advanced age. According to Mr. Thomas, about 10 years ago, after a prolonged illness, he started noticing a noticeable decline in his health, particularly in his sexual function. He almost lost the natural morning reflex. Instead of accepting aging, Mr. Thomas proactively sought knowledge by reading books, listening to health programs, and consulting directly with specialists in urology. From then on, he started a regular routine of gently massaging his genital area every morning, treating it like a body care ritual. Along with this, he adjusted his diet by eating cleaner, reducing red meat, increasing vegetables, and going to bed earlier. Mr. Thomas also maintained the habit of walking 3 miles every day, drinking enough water, and keeping a positive attitude. After about 3 months, he began to notice changes. His nighttime urination frequency decreased, he woke up feeling lighter, and most surprisingly, his sexual function gradually returned. To this day, after many years of maintaining this routine, Mr. Thomas is healthy, without the need for supplements or hormone therapies. He has preserved his confidence and intimacy with his wife in a gentle, natural way. Mr. Thomas's story shows that age is not a barrier if we know how to care for ourselves, understand our bodies, and remain persistent day by day. There's no need for expensive medications or supplements, just the right knowledge and consistent, gentle action. With the right approach, we can certainly keep the flame of youth alive, even after reaching the age of 80. Fifth, important tips to ensure safety and effectiveness when performing the technique. Ladies and gentlemen, while massaging the penis daily is a simple, safe, and natural method to achieve the desired results without causing any adverse effects, we need to keep a few important points in mind. First, don't confuse it with an act of arousal. The purpose of massaging is to stimulate blood circulation and restore sexual function in a healthy way, not to create pleasure or lead to ejaculation. Approaching the technique with the mindset of physical therapy will help you avoid misunderstandings and incorrect beliefs. Second, don't overdo it or apply excessive force. Massaging doesn't require a strong grip. If the technique is too rough, it won't help and could cause bruising, skin abrasions, or damage to the corpora cavernosa. It's also not necessary to perform the massage multiple times a day. Once is enough. Consistency is the key to seeing results. Third, stop if you notice any abnormal symptoms. If you experience pain, tingling, or prolonged swelling or redness during the massage, stop immediately. It's important to consult with a specialist to identify the cause of these symptoms. Fourth, avoid massaging when you have infections or acute conditions. If you are dealing with a urinary tract infection, genital infection, or undergoing treatment for serious medical conditions, you should postpone the massage until your body is stable. Correct understanding and consistent practice are the key to achieving the best results with this method. In conclusion, maintaining the habit of massaging the penis every day is a simple but effective method for improving sexual health and maintaining vitality, especially for middle-aged and older men. However, it's crucial to perform the technique correctly, combined with a healthy lifestyle and regular health checkups. Always remember that taking care of your body is a long journey that requires patience. If you have any questions or want to share your personal experiences, feel free to leave a comment below this video. Don't forget to like, subscribe, and turn on notifications so you don't miss any future helpful videos. Wishing you all good health and happiness.